A lot of people assume Medicare is going to cover everything once they retire, but the truth is that healthcare can become one of your biggest expenses in retirement. So let's take a closer look at what's driving those costs and what you can do now to prepare. If you're 55 or older, you've probably noticed the cost of everything going up. From groceries, gas, to insurance, it's all more expensive than it used to be. But healthcare, it's rising even faster. This isn't just regular inflation. This is healthcare inflation. Prescription drug prices are going up. Medicare premiums continue to increase. And as we live longer, we typically need more care, not less. According to a study by Fidelity, a 65-year-old couple retiring in 2025 is expected to spend around $350,000 on healthcare throughout retirement. And that's just the average. That number doesn't include long-term care or unexpected medical events. So let's start with Medicare, because that's where most people begin. Medicare is a core part of retirement healthcare planning, but it's not all-inclusive. Here's the simple version. Medicare Part A covers hospital stays. Most people don't pay a premium for it because they paid into Medicare during their working years through payroll taxes. Part B covers doctor's visits and outpatient care. You'll pay a monthly premium for this, and if you're in a high income bracket, you'll pay even more. Part D helps with prescription drugs. Part D is optional, but it's really important and recommended. Prescription drug costs can add up quickly, and this is your main line of defense. Then there's Medicare Advantage, also called Part C, which bundles Parts A and B together and sometimes includes extra coverage like dental or vision. Advantage plans are offered through private insurance companies and can be a good fit for certain situations. But here's the catch. None of this covers long-term care, and each part of Medicare comes with its own premiums, deductibles, copays, and potential coverage gaps. So yes, Medicare is helpful, but it's not a free ride. Now, retirement healthcare costs aren't one-time expenses. They're ongoing. They continue for the rest of your life, and they often increase as your health needs evolve. That's why I recommend treating healthcare as its own category of expenses in your retirement plan. Here's what you want to include in that category: your monthly Medicare premiums, the cost of any supplemental or advantage coverage, out-of-pocket expenses like copays and deductibles, prescription drug costs, dental, vision, and hearing, since they're not always covered by Medicare, and eventually, potential long-term healthcare needs. If you retire at 65 and live into your 90s, that's 25 to 30 years of rising medical expenses. You want a plan that grows with you, so your income can keep pace with your needs. Now, if you're a high earner or you have a significant nest egg, there's another important detail that you need to plan for, and it's called IRMAA. The more you earn in retirement, the more you're going to pay in Medicare Parts B and D premiums. But here's the good news. There are smart ways to manage this. For example, you can do Roth conversions before you turn 73 to reduce your future taxable income, or take strategic withdrawals that keep you under the IRMAA brackets. You can also use charitable giving strategies to reduce your income without reducing your impact. Now, let's talk about the 10,000-pound elephant in the room: long-term care. Medicare does not cover nursing homes, memory care, or full-time in-home support. And this is where many retirees face their biggest financial shock. So what can you do to prepare? Well, there are a few different options, and let's look at a few of them. One is traditional long-term care insurance. This gives you coverage for things like nursing home care or in-home assistance, but the premiums can be very expensive and aren't guaranteed to stay level over time. Another option is a hybrid life insurance policy with what's called a long-term care rider. These policies combine traditional life insurance with long-term care benefits, and they're becoming more popular because they offer flexibility and predictable premiums. You can also self-insure, meaning you set aside a portion of your portfolio specifically for future care needs. That works well if you have the resources and want to stay in control of how those dollars are used. Planning for long-term care isn't about fear, it's about choice. It lets you stay in control of how, when, and where you receive care later in life. Here's what I want you to take from today's conversation. First, retirement healthcare costs are very real, and they're rising faster than most people realize. Second, Medicare is helpful, but it's not complete. Third, planning ahead gives you more options, not fewer. And finally, the sooner you start, the easier it is to manage all of this without stress. Thanks so much for watching. If this video helped you feel more confident about retirement, please give it a thumbs up, and don't forget to subscribe for more clear, helpful financial guidance every week. Take care, and I'll see you in the next video. Hi, my name is Justin Haywood, founder of Haywood Wealth Management. And if you're interested in learning about how we help our clients live their retirement to the fullest, visit us at haywoodwealth.com. Thank you so much.